Good morning, everybody. Welcome to this week's press conference on COVID-19 vaccination efforts in Lucas County. Today, we have several special guests to talk to the community today. We're going to be talking about several things, of course, the routine update on the vaccination process, but something very special today that I'd like to tell the community about, and that is our equitable vaccine distribution process. And before we go too much further, I'm going to introduce our speakers today. Today we have Representative Paula Hicks-Hudson. We have Reverend Dr. William Perryman Jr., President of the NAACP Toledo branch. We also have Tina Skeldon-Wozniak, the President of the Board of Lucas County Commissioners. I'd like to introduce Paula Hicks-Hudson as our first speaker today. Representative, could you please begin your comments?
Thank you, Eric. And I thank you for this opportunity to talk from not only a local perspective, but also from a state perspective. Being in the legislature, we have seen, unfortunately, that the state administration, the governor's administration, has not been efficient and slow in the rollout for the vaccines. One of the things that I have been concerned with is that we don't really have a comprehensive state plan for the distribution, and that it's due mostly to the fact, up until just recently, not having the right number of vaccines. And what that has done is continually to disproportionately affect the minority community and those that are most vulnerable in terms of being able to receive this vaccine, that want to receive it. It's unfortunate that the state of Ohio ranks in the bottom of the states for getting shots into arms, behind similarly sized states such as North Carolina, Illinois, and Pennsylvania. You know, we've had nearly a year of disastrous testing rollout. We've had problems with all kinds of things, and unfortunately, the state administration is continuing to do that. But what does that do to us here on the local level? It causes our county commissioners to have to scramble and try to figure out what there needs to be done. So what do we need to move forward? From the state perspective, we need a plan that really looks at and be predictable about the number of vaccines that are coming in to Ohio, so that our vaccine centers are able to plan and be able to have the trained health workers to get those shots into the arms. We have been seeing, there's a concern that minority communities don't have the information. They do have the information. What they don't have is access to the vaccines. And so I'm really excited, and I don't want to take the thunder from Commissioner Wozniak or from Reverend Perryman, but we have worked together here at the local level to address this issue. And I'm really proud and I'm happy to be on this call with my friends and my colleagues, because we took this bleak situation from the state and we are turning it into an opportunity for us. There's a thing about local control, and when local people are able to have the resources that they need, we're able to do what we need to do. I'm very proud of the fact that we have, in less than a week's time, put together a plan that we think going forward will be helpful to address the issues of getting those shots into arms. We're moving in the right direction. We're going to, not only from our local level, but also from the state level to the federal level, to make sure that with our partners, we're able to vaccinate the citizens who want to be vaccinated, and to provide the education for those who don't understand what's going on, for them to make decisions about whether they should or should not get vaccinated. I plan tomorrow morning to get vaccinated. Because I talked to my doctors, I've talked to some other people that I trust, my brother who's a physician and my sister who's already had it, to know that it is something that we need to do. And so I'm telling you that as, just free advertisement for what we need to do. But I want to say thank you to my colleagues, to Commissioner Wozniak, and also to Reverend Perryman, for helping us take the lead to move this forward, because we are moving in the right direction, but it requires that we keep our foot to the pedal, that we look at what's important, which is to look to the consumer, to our constituents, to our citizens who are within that particular age group. Right now, it's still 65 plus with and or with a chronic condition. And with that, I'm going to turn it over to Commissioner Wozniak, or does it go back to you, Eric?
Goes to Willie, I believe.
Go ahead.
Perryman, I'm sorry, I didn't get the lineup.
Commissioner, go ahead. Why don't you go ahead next?
You want me to go next? All
Yes.
right.
I'm sorry. I always mess up the lineup.
Commissioner?
Reverend Perryman, are you good with that? I want to make sure.
Absolutely, yes, ma'am.
All right, we're all so excited to work together that we don't really care who goes first or second, but this is a critically important day. Representative Hicks-Hudson, I hit the nail on the head. We have worked very, very hard to get the opportunity to have a strategic plan to make sure that anyone in the Black or Brown community that wants a vaccination will be able to get one in a timely fashion. In order to make that happen, I think we broke the dam this past Monday when, after the state legislative team from Northwest Ohio with Representative Hicks-Hudson, with the mayor of the city of Toledo, with the county commissioners, we continually ask the governor, open up the vaccinations to the local health department so that we could have local control and create a plan. So what you're hearing today is that we believe that we're going to have an opportunity and that there is a strategic mapping out of how to get our community to believe that their trusted representatives, such as NAACP, such as the faith-based community in the Black and Brown community, such as the movement, and those entities that people know that they will trust that if they're getting shots, that it's safe for everyone to get shots, and that also they can trust that there's a plan, and that when they seek to get an appointment, they'll be able to get an appointment, and that they'll be in a trusted location where they will be cared for properly and the situation will go smoothly. So we're very excited. About a year ago, we opened the Emergency Operations Center, and we've had great collaboration between the Mercy Health System and the ProMedica Health System and all the healthcare work, teams around the community, including the Neighborhood Health Association. But now it is important that the people that do the work in the community on a grassroots level are part and make a plan that makes sense for our community. So that's what we're really talking about here today. And this is essentially being kicked off as early as March 8th. And in order to do that, we're going to branch out to those that can really help us make sure that people can either call in for an appointment through the processes that are being laid out, or they can actually go to your local library to make an appointment in order to make sure that people have access to the vaccination. So we're excited that the Area Office on Aging is continuing to do a heavy lift for us to make sure that people that are 65 and older have help in obtaining that pathway to get the vaccine, and the United Way and the V Project, which are all doing things to fund programming to make sure that the transportation issues can be alleviated. And so it's this collaboration that's critical in order for us to break down the barriers. So trusted sources, dedicated pods for the Black and Brown community, and a continued effort to break down any myths that we can to make people comfortable to obtain that shot. So we're going to, today, our health department, Dr. Eric Z, is going to lay out the beginning process that we're prepared to talk about here today. And mostly that we're excited that we can tell everyone that all people in our community, all citizens that want the vaccination will be included in this process. And I believe shots are going to come quicker and faster now that we have more vaccinations targeted from the federal government, but also critically important is that our health department will now be allowed to have more local control to work with the president of the NAACP, our elected leadership like Paula Hicks-Hudson, and all of our community resources that we have at our fingertips that know how to reach people and do a terrific job. So I couldn't be happier to work with my colleagues today. I'll turn it over to president of the NAACP and pastor of the Great Jerusalem Baptist Church in our community, and let's get things rolling.
Absolutely. Thank you, Tina, and certainly thank you, Representative Hudson. Eric, thank you so much. And certainly on behalf of the constituents and the board of the NAACP, we're certainly appreciative of being a part of this strategic plan as we roll out this plan to help specifically people of color get these shots. As we know, historically, communities of color have mistrust and apprehension when it comes to receiving health care or government-associated programs. And so because of this, it is imperative that trusted individuals or trusted organizations in these communities are known and can assist with vaccination efforts. There are a number of voices in our community of color that could effectively assist with grassroots efforts surrounding vaccine education. And so we also know that misinformation circulates quickly, and it is our duty as the NAACP, it is our duty and responsibility to do our best to spread factual information to our brothers and sisters. Our community of color look to familiar organizations they are comfortable with to provide guidance and promote vaccines. And so as president of the NAACP, I want to share with our community some trusted organizations that will assist you in getting vaccines, faith-based organizations, of course, the National Advancement of Colored People, the NAACP Toledo branch, the Movement, United Pastors for Social Empowerment, the Interdenominational Ministers Alliance, the Baptist Ministers Conference of Toledo and Vicinity, the Baptist Ministers Foresight of Toledo and Vicinity, the Center of Hope Family Services, TUSA, Toledoans United for Social Action, Pastors United for Change, the Toledo Coalition, along with the African American Male Wellness Walk Initiative, the favorite farm labor organization known as FLOC. And I want our community together to know that we are gathering all of these organizations of people of color. We will work with these and other organizations, individuals directly in our community of color, and we will assist in making vaccines appointments. And I want to just charge our community, let's get these shots. These shots will be available. Thank you, President Wozniak, along with other county commissioners, County Commissioner Gerken, as well as Gary Byers. Thank you, Paula Hicks-Hudson. You always have our back. And Eric, it is just a pleasure. It is a pleasure, sir, to work with you. Let's get this done so that Northwest Ohio, that Lucas County, and that the city of Toledo get our fair shot of shots. Thank you.
Reverend, thank you for those very kind words. And I'm looking forward to working with you and so many others on this very important topic. I am truly excited today to talk about this plan. It is our first draft, and we need to understand that we needed to start off at some foundation. We needed that to grow. However, we understand the importance of the equitable promotion of access to the vaccine itself of communities of color, while enhancing the vaccine availability for all those who are the most vulnerable. One person, one agency, we cannot accept they do it alone. There's no way. So in order to reach and capture some of the most vulnerable and underserved that are part of the Black and Brown community's audience, we have to partner. We have to make sure that you as community members have access to those trusted community leaders and members that can give the true story, that can say those things that are so important to get those vaccines into those communities. Additionally, we have created partnerships with the two largest health systems in the area, Mercy Health and ProMedica, along with some great trusted partners as well too, the Federally Qualified Health Center, to the Neighborhood Health Association, and we really need to understand too that collaboratively created equitable distribution plans for Lucas County The plan by no means is set in stone. It cannot be. It's got to be a living document. Matter of fact, this morning we had some comments about the plan again to make it better. This is what we want to do. We want to modify it. It's not my plan. It's not the EOC's plan. It's the community's plan, and we all have to work together to make sure it is a viable operational document. The plan itself is created based on 4 strategies. And those 4 strategies really are 20% of the weekly vaccine allocated received by the health department, Mercy, ProMedica, and the NHA will solely be for communities of color, at least 20%. Those doses are going to be set aside every week, ensuring that communities of color have equitable access to the vaccine, as we need to reduce the disproportionate impact of the virus on those communities. That is the mission. Breaking down access barriers to current vaccine clinics is a must. An example of this includes utilizing the Toledo-Lucas County library branches as an in-person scheduling hubs for those who may not have access to technology, transportation concerns. Libraries are widely trusted in Lucas County, and I think this is a great point that we have to use to be able to, again, get vaccines into their communities. Addressing these barriers will lead not only to higher vaccination rates for our communities of color, but contribute to overall health. And that is going to be so important. Communication from trusted partners in those communities of color to promote vaccine availability conveniently within these neighborhoods is a must. We have to make sure that we're getting the right information out. That is not a myth. They're not falsehoods, they're the truth. And that is going to be a key to making sure we get as many people vaccinated in the community. Again, we will be relying heavily on our faith-based organizations, which is, again, an important trusted partner, and other trusted organizations that the Reverend has mentioned earlier. Again, we can't do this alone. No one agency can do this. So this is a very heavy lift for this community. The last strategy of our plan includes the operation of dedicated vaccine clinics for communities of color in convenient and trusted locations. This is another important concern. We understand that there are some barriers to both of those entities and both of those concerns. So we really need to make sure that we're knocking down that barrier. Example of these locations includes the Flock Health Center, Adelante, our FQHCs, some fixed sites that are essentially located. Again, we're going to be looking at pop-up points of dispensing and some mobile points of dispensing as we move into the plan and over time when we have more vaccine. The health department, along with its partners, our elected officials, those trusted community members, are steadfast in their dedication to taking every measurable possible procedure, tactic to eliminate the disparity in access to the COVID-19 vaccine between the community of colors and the remaining community. This is so important. This is a cooperative process that engenders equitable access to the vaccine while benefiting the entire community. Again, it's only together that we can close this vaccine gap. So excited. We got a lot of work to do in this community, as in the state, but we need to focus on Lucas County. We need to focus on making sure that our people are taken care of. And we're going to do that as a collective, not as any single organization. We're not working in a silo. We must branch out. So let me just move on, and we'll be taking questions here in a second, but let me finish with the update for this week. So we're in the 7th week of phase 1B vaccine distribution. Vaccine has been started by 14.75% of our population. Not good, not bad, but this is the concerning point. Only about 5.56 of the African-American population are receiving their first vaccine. Again, very low. This disproportionate data shows just how important that our plan to move these vaccines into those communities is so important. We need to promote that vaccine and the vaccine distribution. Please note, those that are 65 and older still are eligible, and we're encouraging you to schedule their vaccine appointment as we continue through the remaining weeks in phase 1B. Registration for appointments has been made easier, and we're continuing to figure out how to make it even easier. But remember, on our website, you can go into the upper right-hand corner and go ahead and click on that box, and that's going to take you to the site locations for available appointments. So again, we are working on other things to make it even easier, This is a good step that we took a little over a week ago or so. I want to remind you, if you pre-register with the health department, you still are going to need to register for a vaccine appointment itself at one of our locations. So again, please make sure that you pre-registered. You're going to have to register for for an actual vaccine appointment. As always, we're still in this phase where we need to continue to wear our mask, and that might be for a while. We still need to social distance. We still need to make sure that we're doing good hand hygiene. We don't know enough about the vaccine yet. We are going to know. Even if you're vaccinated, you still are going to need to do those things. So again, it's really important to continue with those things we've talked about now for almost a year: wearing your mask appropriately, washing your hands, social distancing. So again, please make sure we're still doing that. Using all these tools, I know we're going to get through this, ladies and gentlemen. So I think this is a good time to talk about some myths. This is our fourth segment of Mythbusters. They're really well put together, and I think they send a really good message. So hopefully we'll be able to go ahead and start that video right now.
Hi, Tom Cole here for Vaccine Mythbusters, and I believe this is our fourth edition, and certainly is an honor and a privilege for me to welcome in the actual brain power behind our duo here, the outstanding Rhonda Sewell. Rhonda, how are you today?
I'm so good, Tom. Thank you so much. And I'm happy to be back with you as always. So I want to know, how did your vaccine appointment go last week? I understand that you and your wife were eligible and you actually got your vaccine.
It couldn't have been run more efficiently. It was perfectly organized, perfectly run. All the healthcare workers that were there were tremendous. My nurse that administered the shot, Ginger, I made a little joke about Gilligan's Island, and I told her if I continue eating pizza as I am during COVID, I put on 5 more pounds, I can be the skipper for her on Gilligan's Island. But and the shot was totally painless, and it was the people were just so helpful. I would tell you, I was in and out of there total in 30 minutes, Rhonda, and 20 of it was just sitting there, waiting after you had the shot to make sure that you were okay. Had absolutely no side effects whatsoever, no sore arm, no after effect, absolutely nothing. And the same case was true with my wife. So it was a really, really positive experience.
Tom, that really warms my heart that you both had such a great experience. And I can't wait really until it's my turn. And I'm so pleased that you're both doing well. But I'm hearing that people are so ready to get their vaccine and they just cannot get an appointment. So that part seems so frustrating because it seems like it should be a lot easier. Do you have any thoughts on that?
I think there's roughly, Rhonda, about 140,000 people in our community that are eligible for the shot, and we're doing about 5,000 a week. Obviously, there's a little disparity in that number, which tells you it's going to take a while, and they're going to have to be patient. My mom used to tell me nothing good comes easy, and by the time I hit 40, my mom was a genius. It's the old Ringo Starr song from the Beatles, it don't come easy, but we're going to get through this. We're going to get it done. We're going to have plenty of vaccine, obviously, with the recent purchases. So it's going to be a process, but it's well worth the wait.
I'm hearing the same thing, Tom. That's so well said. And your mom gave you some great advice. And the numbers really are surprising. So we can share with you some official data from Lucas County, as you stated earlier, that shows over 140,000 people being eligible to get the vaccine now and only getting 5,000 or so doses a week. That means this will take some time.
Props to your mom, Billy Johnson, with the Office on Area Aging. She does such a remarkable job. I had the pleasure to work with her a couple times on things, and she's such a remarkable lady and does a great job. And they're helping get information out there for the older folks in our community. And that is absolutely fantastic.
Absolutely, Tom. And individuals who also need language access or help with technology can call 211. Also, seniors, as you mentioned earlier, who need special assistance they can call the Area Office on Aging, and these resources will continue to expand.
You know, as always, Superstar, if you want the most up-to-date, accurate information about COVID, which is so essential and so important, people will deal with it appropriately if they have the information. You can get it at the Lucas County Health Department webpage and also at the V Project webpage. Superstar, I'm looking forward to chatting with you next week.
Definitely, Tom. Thank you so much. And as you always say, stay safe and stay informed.
Again, just a great segment every week. A lot goes into that, and I do believe that they are beginning to break down those myths that are around COVID-19 vaccination. So again, thank you very much for doing all that. So at this point in time, I know we have media partners on. I would like to open it up for questions, but before that, I really want to thank the other three individuals who are on here. They are great leaders for this community, for the state. They have done significant work with the group that is putting this plan together to make sure that we're on the right track, and that their leadership is just amazing. And I do appreciate them for what they've done. There are so many others in this community that are going to be leaders as well, and I thank them ahead of time. So with that said, please, can we open up for questions from the media?
Amy Steigerwald, please go ahead and ask your question.
Hi, Eric. I think you said a percentage, 5.56% of people of color have received their first vaccine. Is that in total so far? I guess, how can you give an indication of how many people have been getting it per week in underrepresented communities, and how this will kind of up the ante since 20% is now being dedicated to them?
Sure. That is specifically for the African-American community, that 5.5652, excuse me, I don't remember the exact number, I apologize. So what we're looking at, again, if you look with the population of African-Americans in Lucas County, we have to vaccinate about 860, if my math is right, 860 individuals per week to keep on raising that up as a percentage point. Again, that is just specifically for the African-American population. I do think that what we're doing right now, we will see gains in that population number.
Melissa with Channel 13, please go ahead and ask your question.
Yes, good morning. I don't know if Willie or if Paula want to take this question, but can you please, give us a picture of some of the barriers that people of color are facing in getting a vaccine appointment right now? Thank you.
Well, some of the barriers are a lot of our senior citizens are just not have the capability or the knowledge on how to electronically register. And so we're doing a grassroots effort to identify some of those seniors who have those types of challenges, and actually trying to not only perhaps get their children or grandchildren to them to help them register, but we have a really good phone bank that we're identifying those persons at that certain age group who are not IT savvy, so that we can get them registered.
And if I can add, for those that are not within, necessarily, right now it's 65 plus, but there is also a lot of misinformation or no information that's getting into our communities to know about where to go. I mean, unfortunately, we've got this media campaign, but the campaign is not, until recently, has not really, in my opinion, connected to the folks that need to be connected. We talk about the faith-based community, but because of COVID, many of the churches are not meeting. And so what you're seeing, if you look at many of the services, they're very bare bones. And so, that's the issue. The other issue, as you heard me talk about earlier, is that the process for those who are somewhat tech savvy, it's not really conducive. I mean, because number one, you have the lack of enough vaccines. So by the time a person is able to go, if they're able to get on, apply, by the time for that say that they had a 9 o'clock appointment, they go through all that, that appointment time is gone. So it's a challenge in terms of education. It's also a challenge in terms of getting the word out to folks. And I'd liken it to that we almost need to do it like it's a political campaign where stuff goes into people's homes to let, with a card or with something to let them know the process. The other barrier, unfortunately, is transportation. Some folks are able to drive, some are not able to drive. Recently, many of the places have not been within the central city, the central core. They've been at the rec center or they've been other places. And so, we're excited that this partnership with Mercy and with ProMedica, but primarily with Mercy, has been helpful in helping to push those numbers up through the neighborhood health organization, as well as what's going to happen this weekend at the UAW Hall, based upon what the movement is doing. The commissioner talked about trusted partners. A trusted partner is a movement, and they've been working very hard to try to help reduce those barriers.
Thank you. I do have a follow-up. Maybe Paula, you might, because you spoke to the distribution of the numbers of vaccines. Do we have more vaccine available in the state than they're doling out? I mean, can you explain that a little bit more? I mean, why is Ohio not getting enough vaccine? I mean, what are some of the, go a little bit further down that road, Paula.
Sure. I mean, unfortunately, fortunately, there's been a change in the administration at the federal level. And part of what we have seen is that the initial rollout under the previous administration was not happy with Ohio, was not happy with the governor because of some of the things that he was doing. And so now under the Biden administration, and we've seen where they've been pushing to have the increase in the production of the vaccine. And my conversations with the governor's staff and his office has been, working to try to get more out of the federal government. So that has been the major problem. And I think fortunately with the change and with the recognition that this is really a very serious issue affecting, people, not, and we can't be a political football. That's what's going to happen. And I've seen from the federal government, the news that there's going to be an increase production, and we've been pushing, our caucus at the state level has been pushing the governor to get more aggressive and to push for getting more vaccines. And I think those finally that has been, he's heard that, and he's doing more to try to get it moving us in the right direction.
Melissa, if I could add, the reason we were pushing for the health department to get more vaccines of the allotment that was available was so that we could create a local plan around working with the different communities that Pastor Perryman spelled out. When they were going just directly to either pharmacies or hospitals, we appreciated that, but we feel that the public health centers are designed to work with grassroots organizations to make sure more people are included. So that's why we're pushing for more vaccines to the public health under Eric's control.
Thank you very much.
Bree, please go ahead and ask your question.
Thanks so much, Shannon. Good morning, everyone. Eric, I think that my internet either cut out or you might have said it too fast. Can you go over again, or if anyone else wants to, just where those locations will be that will be more accessible?
Oh, well, let me do this. We're utilizing some of our other locations we have been using because, again, people understand where they're at. We'll also be looking at other sites to open up new types of pods in areas where they're underserved, or really we know where the vaccines have been given, so we can drill down into those areas. We'll also be looking at here in the near future how we can actually do some specific or precision type of pods in those areas. So with that said, more to come on that. Also then too, I want to make sure that everybody understands that, again, our trusted leaders are having access to these links to sign up. So they're going to be able to, again, specifically put people into those scheduled time slots, and those vaccines are dedicated for those individuals. So Bree, more to come on exactly where they're at as we move through the planning process.
Great, thank you.
Sure.
Our last question comes from Tom. Please go ahead.
Hello, everybody.
Hi.
I have a kind of a two-part question for Eric. First, can you clarify that 5.6%? Are you saying that of all the vaccines that have been administered, 5.6% have been to people of color?
No, the clarification, if you look on the Ohio vaccine dashboard, you'll see an updated number every couple hours, actually. That is the population, or the percentage of the population, the African-American community that has been vaccinated. So that's what that number is.
Okay. And then if you're setting aside 20% for people of color, and only 5.6% of people of color are getting the vaccination, does that mean that 14.4% of vaccine is going to be sitting unused?
Again,
piling up week after week?
No, Tom, that's a great question. Let me explain this one more time. I know this can get all confusing. We're almost mandated to get vaccine out within 7 days. Okay, so our throughput has to match that. Now, sometimes, like with the snowstorm the other week, we're having some issues catching up, but I think all of us are almost there to make sure that those vaccines are out, so they're not sitting on the shelves. So what we're doing is we're setting up these pods, these points of dispensing sites. And this first one that we're having this weekend has already been filled up. It filled up pretty quick. We're going to go through this entire process, and we're going to see how many people will be signing up over the coming weeks. And then we're going to, again, this is a living document. So we're gonna have to figure out then if we have 500 slots and only 400 are filled up with our underserved population, why don't we have that other 100 filled up? So we're going to have, this is why it's so important to be working with our community leaders, because we're going to have to figure out why that's happening. So there will be no time slots there's no doses that are going to go to waste. First off, time slots are going to be filled up. If they're not filled up, we need to immediately figure out why. I just got a text today from the Ohio Department of Health, was asking about just in general the vaccine process. Are we seeing a slowdown in those individuals that want to take the vaccine? In other words, do we have open slots? In this community, we have no open slots. So again, I had to reply back to the Ohio Department of Health. No, we are not slowing down. We don't see a slowdown. That's going to also then too, let me just go a little bit further here, just so the community understands. Why is that question being asked? I think what they're trying to figure out then too is how do we move into different categories? If it's slowing down, one, why? But then two, can we open up another age group, like 60 and above? Does that answer your question, Tom? I hope.
Not really, Eric, because if what you're
Tom,
saying is that.
Tom, let me jump in real fast, because I can just give you a real quick example. And the reason why I jumped into this whole process, there are, as Eric is saying, there are community organizations that are willing to help sign people up. This event that's going to happen tomorrow at UAW, the question was whether or not there was some concern starting out whether or not that the movement could provide 500 people for 500 vaccines. That was probably done, before, when we had the conversation, they had more than 350 people signed up. A month ago, when the vaccines first started up, there's a FHQ or whatever they're called that told me that within 90 minutes of their opening their phones, their allotment of vaccines that they could provide was gone. So there is a demand. What we're doing now with this plan is getting the folks who have been underserved access to the vaccine, and that is to me a major step in the right direction that our community is doing. And I believe that the backstory of why Eric is getting that call is because of that the governor's office is trying to make sure that they can show that there is a continued demand across the state for these vaccines, so that they can go to the feds and say, we are still not getting enough. And that's the issue that we're dealing with. So I don't know if that helps you or not, but just know and understand that if there are vaccines in Lucas County and people are not showing up, I even know that at some places, folks are standing in line that are eligible in case someone doesn't show up so that they can get that vaccine. That's how important this is and how many people are looking at that. Unfortunately, in the minority community, Black and brown communities, folks don't have the luxury that they can stand in line because they got to work or they've got other responsibilities. So we're trying to match that up, but understand that vaccines will not go to waste, because the demand is much greater than the supply.
So I still have the question. If you set aside 20% and you don't get enough people to use that 20%, does the 20% get used? And do you run the risk of having that 20% sit so long that it becomes unusable?
I'm going to answer this for you, Eric. The short answer is no.
And
Okay.
why set aside 20% if it's not really going to be set aside?
Hey, Tom, I'm sorry, and I don't really want to get too much of the weeds, but we'll get into a little bit of the weeds. So we work, I swear, 24 hours a day on this. If we're seeing that doses, let's say schedules aren't being filled, we then will maneuver those doses around to another entity that is clamoring for it. So this is real-time distribution when we come to the doses. So again, there's no doses that are going to go to waste.
The level of partnership is so good and so intense that there will be no doses wasted, and the Black and brown community, we will reach the goals that we aspire to based on the level of collaboration.
No doubt we're going to meet that percentage or more. And be very honest with you, Tom, 20% is just the bottom line.
I agree.
We have people right now that my phone's ringing right now. The movement's phone is ringing right now. Center of Hope, Family Services, we're ringing right now. No dosage will go to waste.
Bree, go ahead with your question, please.
Thanks, Shannon. I just wanted to quickly follow up on this event tomorrow. If someone could elaborate on that, and if that's kind of a part of this timeline of rolling out this new plan.
I'll speak on that if anybody wants to chime in. We have been working this 20% allocation from the health department for a couple of weeks. It's just that we've grown this into a much larger partnership. So what we're trying to do here is start the process this Saturday. Again, the movement, what an amazing organization that they've been able to, again, populate 500 spots for the UAW Hall clinic tomorrow. This is just the first step. We're going to see much more of this over the coming weeks. And if we can get 100%, that's what we should be shooting for. 100% in every category, but 100% specifically right now in that African-American community, get everybody vaccinated. We know that's not achievable for a number of different reasons, but 80%, that is, I think, achievable. And I think that's what we should be shooting for.
Are all of those already booked up for tomorrow?
Oh yeah, they were gone at least 24 hours ago, and they only had, I think, 2 days to actually populate that. So again, pretty good for the first time out for them to actually, if you would, make sure that everybody's scheduled. So great job on their part, and this is actually exciting, to tell you the truth, how fast they actually worked and got this together.
Great, thank you.
Yeah, just let me add that all of these trusted partners that I named earlier in my statements, we're working collectively. We're working 16 hours a day. The movement just really pushed that out. But these other organizations, trusted partners that we have collaborated with, that we are collaborating with on a daily basis. This is a great effort that perhaps have never been seen in Lucas County with all of these minority organizations. And we haven't even talked about the fraternity organizations. They are on board. So this is a great collaborative effort of the minority community that has never been seen before.
Great, thank you so much.
Can I ask one more question? I haven't seen too much information about this UAW thing tomorrow. This is the first I'm hearing about it. Are these 500 slots only for people of color?
Yeah, they're booked through the movement, yes.
And the movement is what? Oops. What's the movement?
The movement, Tom, is a grassroots organization that came to the health department and said, we're willing and wanting to help you know, increase the number of shots for color, you know, not just the African-American community, but the community of color. And so in partnership with the health department, they were able to get folks signed up. And so this was done, you know, as a partnership. So it wasn't really, you know, quote unquote advertised outright, but it was advertised in terms of the movement, you know, touching the people that they deal with. Reverend Perryman, you want to add to that?
Yeah, Tom. So the movement is also connected with the faith-based part of our community, as well as the NAACP. And so we've had faith-based organizations, different churches, the NAACP, the Ohio Unity Coalition. We're all collaborating with the movement. The movement took the spearhead in terms of making sure we got people registered, but churches in our community, the NAACP, and all of these other organizations that we have mentioned, we have funneled names of people who qualify to get these shots on tomorrow.
All right, thank you.
Just let me add one more thing to the UEW Hall. Again, vaccines are limited. And so, again, this is the partnership that we have. ProMedica is doing a great job working on getting out to the underserved. You know, NHA, Flock, I can't say enough about them, but the representative talked about Mercy. Let me tell you, we got doses from Mercy so we can make that pod actually happen. So again, it goes back to the partnerships. We have to have partnerships to make this all work. We would only have been able to do half of the 500 with our doses that we had, but Mercy was able to, again, help with the other half. So thank you to Mercy, but thank you to all the other partners that are helping out and will help out.
Can I add also now, Tom, these trusted partners also have Caucasians are part of our movement as well. So they're going to be, we have white Caucasians that are part of our congregations as well. So don't look just for people of color in line. There's going to be some whites in line as well.
I have a question, Melissa Vage from 13ABC. Couple quick questions. When can people start to go to the library to sign up? And then the second one is there a central number that people can call for the movement to get to connect with them?
Yeah. Hey, Melissa, thank you for that question. Details will be Monday for that as we roll out the plan. Again, the library is working with us to make sure that we that's staffed appropriately and that they have all their ducks in a row, if you would. So look for that on Monday.
Or they can call the NAACP office as well.
Okay, so on Monday, you're going to release the plan for people to go to library. Like, don't do it this weekend is what we're saying. In the meantime, they can call the NAACP, right?
Yes, if you can give the library a little bit more time to make sure that, again, they're staffed appropriately and their resources are in place.
All right, thank you.
All right, I do believe that was our last question. Again, I appreciate everybody being on today. This is a great message. Please get this out to the community. Again, much more to do, but this is a great start, and we'll be working hard to make sure that we get people vaccinated. So again, thank you. Have a great weekend. Be safe.